The People First podcast is a show presented by people with learning disabilities for our friends and the community. We talk about issues that are important to us and interview interesting people to find out new information. This is our way to make the difference and have our voices heard.
Hello and welcome to the People First podcast. Today we are happy to welcome one of the great people we met during the Take Good Care of Yourself event in September, Darren. Darren works the public health team at Bradford Council and has come on the show today to talk about what public health do for us in West Yorkshire. Welcome to the show, Darren. Thank you for joining us today.
Thank you very much. Thank you for having me. Lovely to be here.
Can you tell us what public health means?
Well, yeah, so public health, there is an actual definition, and it's a bit of a posh one, I must admit. So the meaning of public health is the science and art of preventing disease, prolonging and promoting health through the organised efforts of society. So what it does is it focuses on disease prevention and the overall improvement in human life. So it looks at the public's health overall. So it looks at your aspects of, like, say, preventing disease management through promoting vaccines, healthy living, eating well, stop smoking. So its main objective and the meaning of public health is to improve and maintain that improvement of health to the public in general.
What does Bradford Public Health do to help people in our area?
Well, the overall department is a big department, so it does a lot of things to help people in Bradford in general. Like I say, there's kind of three main areas of public health. So we have health improvement, health promotion, and health protection. And particularly in the health improvement area, the health promotion, they commission the services that help support families in Bradford, right through from when a child is born, right throughout the childhood. So things such as health visiting, the council will help commission those services, so health visitors, school nursing, all the way through to when you become an adult. So a lot of the health improvement, that team does things like stop smoking cessation, which is help people stop smoking, weight management, and to improve your overall health. So, the public health is there to be an entity that helps people maintain a good healthy life, helps to put them in contact with the different charities, organisations that can help you, maintain that good health. And they also run many campaigns as well. You might have seen there's been a campaign which promotes the 20-minute movement each day. So it's kind of like, you do as much as you can do. I know a lot of us, myself included, we don't like to work out. So it could be something simple, doing a 20-minute walk around the block if you've got dogs or if you've got friends to go out with for a walk around the park. 20 minutes of movement help in the day. So they promote things like that to the community as well, to help the community engage in programs where they can kind of be supported into having a healthy lifestyle. From our point of view in health protection, we look at lots of promoting screening processes. So I know when we had the event downstairs here, there was a lady from the screening for breast screening, and I know at Odsall Stadium in Bradford we had someone from prostate screening as well. So going into these screening programs and being able to access them, knowing that they exist, is a good thing, because if you can get screened for breast cancer or some of the other cancers, or anything the NHS will provide, you can then get help to get over that particular infection or disease or cancer. So what the council we do is we promote this in line with NHS England. They're the ones that will kind of do it in the ICB. And we promote many things. I myself have done awareness around antibiotic resistance. So a lot of the tablets we can get from the GPs these days, a lot of them still work, but there are some infections, like bacteria infections, that will be resistant to those antibiotics. So I did last year, and I will do this year again, an awareness campaign, put it on screens around Broadway, just highlighting to the public to be aware of only use antibiotics if you need to use them, and when you do, use them as prescribed by the GP. So take the full dose when you need to. So it's all about, we help to get the message out there in general to people, and then help guide them through what can be quite a maze of different organisations, and I'll probably mention it later on as well, but there's a Living Well website, which is a very good resource. It's Living Well, it's called, and it's a very good resource for highlighting different things you can go into that can help with your needs. So that's kind of what we do as a whole. We like to help people.
How do you help people who find it hard to get to the doctor or dentist?
This is a tricky one because we don't have too much to do with that side, because this is a lot of this is funded by the NHS and the Health Service. But we do work with partners and try and support those services to be able to cope with the demands that people have. So, for example, if you may feel you've got an issue that might not be for the GP, but you want to go to the GP, the Living Well team might be able to help you with that. But I know from myself that if I ever got a call, because we are public health, so we serve the public. So many queries or questions that we might have from the public, I know from my own point of view, I would help that person overcome that issue. So it was to find a GP in the area. I could help look for, GPs in that postcode. So which one's near you? You can also look on websites like the CQC, so it can help with that, looking at which one might be the best one in that area, if you want to choose the best one, and the dentist as well. So we could certainly help, because I'm here to serve you as a public. That's the idea of public health, in my opinion. So although we wouldn't necessarily do that as our main job, it's certainly something I would see as a role as a public servant and somebody that's here to help you find these things. So if I couldn't directly do it, I would maybe put you in contact with somebody that could, or like I said, I would help you look online to see what was there in the area. So the health service in general, we don't have a great deal to do with it, but we certainly can help you navigate, maybe find that GP service. And, there's many GP services that I do believe many are accessible now for people of all backgrounds. So it could be that a certain GP service offers a really good service for people who have mobility issues. So we can kind of look at those things, help you navigate those. So it's not our main kind of reason why we're employed, but it's something we can help you with, because like I say, I see it as a duty to help those people in Bradford, Keighley, Airedale, Ilkley, all the areas. So we certainly would. I wouldn't leave you hanging, basically, is what I'm saying.
What can people do every day to look after their health?
Well, I suppose it's kind of making sure that you are eating well, that you've got that good group of friends around you as well. I think it's engaging, if you need to, with medical professionals. We were talking downstairs around kind of nutrition bars. It's always good to have a look at kind of what the NHS would promote. There's also UKHSA, the United Kingdom Health Security Agency, who kind of do a lot of research into things that we can eat in our day-to-day life. Exercise, well, that is good for us. So I think it's about, like I say, it's about knowing your limits, not doing too much, because sometimes there's a tendency to push ourselves, and sometimes you can do more harm than good. So knowing what you can do, and linking in with those organisations, like I say, on the Living Well website, there are links to many different organisations that can help you, that can guide you through, having a day-to-day plan of what to do to stay healthy, what to eat, how to exercise, groups to access like IMAS, who were here downstairs before, people that can kind of get you in with groups of people who can help that, not only physical health, but your overall mental health as well. So these are kind of little things that you can do to stay healthy. And like I said, the Living Well website is a really good resource to look at. Plenty of good links on there. Have a little look, have a little Google, Living Well Bradford. And and I think a positive mental attitude, try and stay happy in life. It's difficult these days, but I think it's a good thing to do. And I think having friends around you can be a big, big thing. I know when I was growing up, and even now, having those people that you can rely on in your life, family, friends in particular, it's a wonderful thing to have.
It's vital.
Yeah, it is vital, yeah, it is. It's very important, because actually we're social creatures. We like to be around other human beings, and I think being on your own, get the social isolation, so of trying to avoid that, I think it's a very important thing to do.
Yeah, worst time was through COVID, really, because I literally set up online groups for the guys here that could join. Yeah,
it's very difficult in 2020. I think the online, what we've learned is we can interact online, and if it's good interactions, that's good. And yeah, it was a very very sad time to be a social person. So I know that much.
How do you help people with learning disabilities to stay healthy?
Well, we do work with many services and partners to help in any way we can. A lot of the services that the council provides is for everybody in general. So an example could be the BEEP, which is Bradford Encouraging Exercise in People. And what BEEP is, it provides a tailored 52-week plan for anybody that wants to exercise, lose a little bit of weight, become more active. And this is open to anybody. And what the experts and the practitioners will do in that team is look at you as a person, see how they can tailor that plan for you, your needs, what you want to get out of it. So really, in general, every service that we kind of provide as a council, or we link you into as a council, it's for everybody in society. So it's certainly it will be tailored and will accommodate every person's needs, wishes, wants. And like I said, we're here to provide a service for everybody in Bradford. So in many ways, we serve and help support people with learning disabilities, adults with learning disabilities, just through our work and through being open to kind of pursuing a way of tailoring a service, listening to the person. We have a person-centred approach, which is a word I love to use, certainly from my days back in nursing. Have the person at the centre. So if you come to the council, you want this service or you want that service, we'll look at your needs, we'll look at what you want, what you can do, and we'll tailor that around you. So it's all about kind of, wrapping a nice comfort blanket around people and saying, we'll listen to what you want, and we'll try and get the best service possible. So in many ways, that's how Bradford caters for everybody in the districts that we oversee. So yeah, we like to be very holistic and person-centred in our approach.
Sounds good.
Mm-hmm.
Do you work with any other groups or charities in the Bradford area?
Yes, we work with quite a few different groups over the Bradford area, mainly to make sure we've got an understanding of health challenges from various different points of view from different parts of our community, and help to creating services or support for the people. The people, what they want and what they need and what they can access easily. For example, we work with local community groups like the voluntary care sector services, such as Mind, the mental health charity, and many NHS services as well. I myself, I've worked with New Vision, who are a drugs and alcohol service. So we kind of tap into every single kind of group or charity that gain access to the communities and help the community in what they need. And we always work alongside with these different organisations quite closely. And in many cases with the health improvement team or the Living Well, they will commission that service. They'll have oversight over those different groups as well. I myself, in health protection, we work very closely with the care sector group. So a lot of my work is with care homes. We cover all the care homes, about 105 care homes in Bradford. So we do inspections. Yeah, there's quite a few overall, and there's only 3 of us that do these inspections. So we're a bit like the SAS. We're small but effective. We get in, get out, and we work with the care sector groups, in particular the Bradford Care Association, who are a really good association. We'll also work with UKHSA. They used to be called Public Health England, but they changed the name to the United Kingdom Health Security Agency, or UKHSA. We work with the NHS and the Integrated Care Board, the ICB. So it's, from my point of view, and I know from the council and the public health point of view, it's we work with anybody that can help people. Especially in public health, we want to work with those organisations, and there's many out there, really good organisations that we can kind of work with, help promote their work, get them linked up with people that need it. So we do work with many different charities and groups, organisations, and we have good working relationships with many as well. And it's something that I particularly like to do, is to what we call join up the service, so everyone works and sings from the same hymn sheet kind of scenario. So, but yeah, it's really good working with these groups. In particular, I know for a lot of the mental health is very important these days, as we've mentioned, and Mind is a very good organisation, and Samaritans as well. So we do work closely and promote these kind of groups as well on our websites and when you speak to us. So yes, we work with many different people, thankfully, very good people.
Well, that's good to hear.
Thank you.
Do you just work with physical health, or do you work with mental health as well?
Yeah, certainly mental health. It's certainly something that we do a lot of work around, as like you said, we've mentioned before. It's very important, particularly in the stresses of today. So, as a council and as a public health department, we've provided many grants to community groups. In particular, I think we've given a grant to yourselves and People First as well. So it's great to pass on the money to people that can use it and help communities. So a lot of these grants will help people have activities to support good mental health well-being. At the moment, we're working on a programme to support more people to engage with nature. So by growing their own fruit and vegetables, growing plants and trees and bushes in their communities, in their neighbourhoods. Yeah. And connecting with nature and being in green spaces like parks in the countryside is proven that it's really good for our mental health. I know when I was thinking about answering this question, and I have to give a big shout out to Nicola Kelly and Joe James, who are my colleagues who've helped me. They've helped me greatly with this. But from my own personal experience growing up, I grew up in the Midlands in a place called Cannock, and we had the Cannock Chase Forest. And of course, this was back in the 80s, where we didn't have the internet and all these things that we have nowadays. But being in nature, being out in the countryside, being in the forests, being in the woods.
That's wonderful.
Yeah, it was really nice seeing all the deer early in the morning, and just having that access to the green spaces is massive, not only for healthy living, clean air, these kind of issues that are really important. But, that mental well-being and good mental health, you can thrive in that kind of situation. So having that kind of access to these kind of things, vitally important. And we help promote those things, help people access and create these kind of green spaces that hopefully are popping up around Bradford now. So I'd definitely encourage anybody that can to use the parks we've got in Bradford, get out into nature, get up onto the moors if you can do, although probably not this time of year. It's a bit nippy, a bit cold, but get out there, and fresh air is great for the mind and the body. So it's definitely something we support and something that we promote. And I know on the Living Well website, there'll be many groups that you might be able to look at and access, kind of go onto their websites and see what they can offer, and whether you can join up to doing a local scheme. So yeah, certainly something we put a great deal of emphasis on these days is mental well-being as well as the physical side of our health.
What messages would you like to share with our listeners about staying healthy and happy?
Yeah, well, it can be a difficult one in today's world, but certainly my colleagues in Living Well, they have a few kind of pointers on what to do, and one mainly is trying to move well. So make sure you do some physical exercise as part of your day, no matter what that can be. I know when we came here to do the event downstairs, we did some sit-down activities, kind of lifting our arms and doing a little bit of shaking. So trying to move the body is good, as much as you can do to within, obviously, what you can as a person, because we've all got different abilities. Myself, my back is really hurting, thanks to my little daughter. So I struggle sometimes doing stand-up physical exercises. So it's all about trying to do what you can. So move well, eating well is very, very important. Eating kind of a balanced diet. I know we had a little discussion before we came up here about eating that balanced diet, everything in moderation, trying to move away from kind of your fast food, processed food with a lot of sugars, salts, trying to get kind of your more natural nutrients. So having a good balanced diet, fruit and veg, 5 a day, all those kind of lovely things, eating good food, basically well-produced food with less kind of processed kind of sugar, fats and salts. That's certainly something. And something we all try and do, but we don't get a lot of, I don't these days, is sleep well. So sleeping well is a really good and important thing, because it can help your body to kind of, reboot itself, get the battery back up again. So sleeping well. And I think as well, mental health is so important these days in society, that doing something that you enjoy is really important. So you've got 4 guitars over there, 2 electric and a bass guitar. So one of my favourite things to do in my spare times is play the guitar. I do play the bass as well, not very well. But, doing something that you enjoy and connect that with us if you can do as well. When I was growing up, I played in a band for a few years when I was at school, and having connections, doing a sport, having connections with other people, it helps you just that kind of holistic well-being, so the overall well-being of your body, your mind and your physical. So connecting with others, we're social creatures, and to be isolated on your own can really damage your mental health and your physical health. So connecting with others, eating well, moving well, sleeping as much as you can. 8 hours sleep apparently is the one. That's the mantra. So those are a few little things you can do to stay fit and healthy, hopefully. And you do it within your limits as well. So everybody's different in life. So we all have, some people can do more. If you can, that's great. If you can't, do what you can do. So like I say in the previous question, 20 minutes exercise a day can be really good for you.
Yeah.
Favourite part of my job? Well, apart from finishing time, I'm only joking.
After a long day.
Yeah, after a long day. Apart from that, that's not really. I do really enjoy my job. I think there's a few different things that I really enjoy. So one of my favourite things that I do a lot of now is coming out and getting into the community. Before the kind of, I've been working since 2013 in Bradford Council, and I didn't really get out much and do things like this or the event that was downstairs. And I'm doing more of that, more people-facing kind of things, and I really enjoy that because I enjoy meeting people, talking to people, helping to support people in the community. That's one thing that I do love. But one of the things I've loved since I started in the job was my work with the care home sector. In particular, like I say, we do infection control audits, so I'll go out there and I will check how clean the premises are, ask questions around hand washing, do you do this, do you do that, and meeting the people that provide the care and the people that live in the care homes, because we've got some fantastic care homes in Bradford and we've got some brilliant people that work in them, and they do a very difficult job, and I really do like that, because a lot of our work, it can help them prevent the spread of diseases, the infections that can carry from one person to the next or from the environment. So going in there and supporting the home, making sure that they are doing things right, gives me a nice sense of purpose and that I've done a good job, because they feel like they're doing everything they can do to protect the vulnerable people, because we have some very elderly, vulnerable people in some of our care sector, and young as well.
And you hear so many bad stories of...
You do. I think
the care home.
That's it. I think it's a shame, because coming from a care home background myself, you never see on the front of the newspaper what a wonderful job a care home's done, and there's plenty of them that do it. But unfortunately, you do when one of them does a bad thing, and it's a shame, really.
Have you ever gone round any care home and then it's closed, even though you've gone there and talked to them, it's closed down eventually?
Yeah, unfortunately, there's been as well as homes opening, there's been many homes that have closed, that have really struggled to survive, or through various different reasons have closed down. Obviously, I won't name any homes, but there's been definitely a few that I've been round, and a month or so later, they've unfortunately had to close the doors, and the premises are empty and people have had to be moved out. So it certainly happens where a home, because there can be various different reasons why a care home will struggle. I know we do have a great deal of difficulty getting staff in these days. It's a difficult job to get staff in to work. Even when I started in the 2001, it was difficult to attract people to the job, because it's a difficult job and it's not very well paid, unfortunately. So that can be a reason for a home to close. So, but I certainly have been, and it's sad. It's sad when it happens, because that some people may have lived in that home for a number of years, and it's where they like to be. They're comfortable there, and then all of a sudden they're in a new environment, in a different home, maybe a bit further away from their family sometimes, although they do try and relocate people, near to the families as well as they can do. But yeah, it's certainly, some homes have, and it's sad when they do, but it's an unfortunate aspect of care. But they open and they can close, but yeah, it's sad they do. But yes, I have, unfortunately.
If someone is worried about their health or wants to learn more about public health in Bradford, where can they get help or advice?
Yes, that's a great question. I think it's always good if someone's worried about their health overall, is to speak to the healthcare professional about what the issue is. So this could be your GP, so your doctor that you signed up with, or a nurse or a healthcare professional that maybe be able to help you with what's causing the issue. It's always good to get that professional opinion. I know some people these days will go on Dr. Google. I've done it myself, but it can send you down that rabbit hole. So you can end up, you've got a slight cut on your finger, but you'll end up thinking you might need to go into A&E all of a sudden, because you've gone down the rabbit hole of Google. So always go to a healthcare professional first if you feel it's of a healthcare nature. So if there's anything kind of different about the way you feel in your body. I know when we did the event here and at Oddsall, Julie from the screening team came to see, so things around kind of breast screening, these kind of issues. So if you're a lady and there's something you feel something different when you're doing a check on your breast, go and seek healthcare advice from your GP or nurse. The same for us fellas. If we feel we may have found something different down below with our testicles, so testicular cancer can be a risk for us, go to a healthcare professional, go to your GP, get the advice you can do. You can also access your free NHS health check with your GP as well. So that's always a good kind of what I class as an MOT. So your car has an MOT. You can go for your yearly checkup with the GP, make sure your brakes are working and all that fun stuff. So make sure your blood pressure's okay. Make sure there's no kind of anything that's going to catch you out, the GP, he or she, or the nurse who's doing it, nurse practitioner, they can help you. And if it's something that you probably think is a little bit less serious, I've mentioned already the Living Well website that Bradford Council provides can be a very good link and give you different advice on different areas. So your healthy eating, your you kind of stop smoking if you want to stop smoking, any drugs and alcohol issues, all these things. So going on the Living Well website, lots of information on many different health-related subjects, which might be something you'd have to worry your doctor about, but you might want some advice over. So certainly, first, if it's serious, go to your GP. If you think it's very serious, obviously go to A&E, phone, the non-emergency line as well if you want to speak to a healthcare professional. But that's the main thing, speaking to a healthcare professional first if you feel you need to. And if it's just something that you want to change your life, so you want a dietary change or get a bit more physical exercise, the Living Well website's really good for that, and it can signpost you to all different fun things that you can do to help yourself and all that good stuff. So there's plenty of things out there, without a doubt.
How can people get in touch with Public Health, Darren?
We do have, obviously on the Living Well website, there will be links to people that you can contact, and some of the people who facilitate the services and commission the services, you can speak to them via the website. And there's also the general line for the council, which you can kind of Google and find online, that goes through to the main switchboard in the council, and then you can provide it with numbers for those. So, say, for example, if you wanted to speak to me, somebody in public health around a health protection issue or, an infectious disease, the switchboard would put you through to public health, and it would come through to myself or my manager or one of my other colleagues. So there's a main switchboard as well. And also there is the Bradford Council website that you can access where you could, have contact with. And there's various numbers available on there for services like environmental health, for example, the Living Well for the adult social care services that I work with very closely with. So yeah, there's a website, Living Well website, the Bradford Council general website, the good old-fashioned phone. Give us a call on the main switchboard number. You can find that on Google if you put in Bradford Council contact, and they'll be able to put you through to whoever you need to speak to. So there's a few different ways. And also you can come into Britannia House, probably get some contact details from people that work in the main desk down in the reception area. So that's certainly one way. So if you fancy a drive out to Bradford, so the city centre's looking lovely nowadays with all the work done. If you fancy a trip down to Bradford City Centre, we're in Britannia House, and they might be able to help you as well. But yeah, certainly various different ways you can speak to us, and we'll help you.
That's all the questions we have for today. We'd like to say thanks to Darren for coming on the show and helping share great what are doing in our area.
Do you have anything else you would like to say before you end the show?
Well, I think it's just, the Public Health Department is here for everyone. So if you ever need any help with anything, any support, any advice, we're always here as a team. There's plenty of people and experts who can help you whatever query you've got. We love speaking to people in the public and helping them through the day-to-day life, and hopefully making Bradford a healthier place and healthier lives. And we're here if you need us. We're a great resource, and there's some very, very good colleagues of mine who are experts in their field that can help out with most issues, and signpost you to people that can help you as well with the many groups and charities that we work with. So just that message to finalise is that we're here for everybody in Bradford, basically, as a team.
Okay, it's been good to talk to you.
Good to talk to you all as well. Thank you very much for having me. It's been a pleasure.
Remember to comment, share on Facebook, Instagram and X. You can find us by searching for the Paper Third podcast. Thanks for listening, and we'll see you next time.